This is week number 1 and lecture number 3. Hello friends.
Hello friends, as you already know that last year we ran a program called Foundation Certificate Course in Palliative Care on Swayam portal, and this time we have come up with another program in the same subject, that's a palliative care. The name of the program is Basic Certificate in Palliative Care, and we are starting number 1 week. This program is basically of 12 weeks, and we are starting with number 1 week. And this is the introductory lecture in which we are going to tell you about all the topics which will cover in number 1 week of this particular course.
Number 1 week is basically a revision week where we'll highlight what you have learnt last year. So starting with basics in palliative care. This is a lecture on revision of what is palliative care. Palliative care is a holistic care, as all of you know. It is given to our patients who are suffering from life-limiting illnesses, and final aim is to improve quality of life of the patient and caregiver.
This is all very medically and scientifically told. I'd like to tell you something just in 3 brief words. What is palliative care and what is it basically meant for us, all of us? Firstly, the aim of palliative care is to improve quality of life. I repeat, quality of life, and which affects all of us. And for that, we say we don't want to add days in life, but we want to add life. We want to add life into days. That is number 1. Second principle is painless survival. Whatever months, years you survive during sickness till you die, you should have a painless survival. And that is where we just come up with, it is low tech and high touch. We do not believe in ICU or unnecessary surgical operation on the patients. We don't want to put the patient in the hospital. We just want to keep him at home, and whatever care can be given by family members, other carers, and that is how the patient must live for heavenly abode. And last, we are talking about death in dignity. Death in dignity means he must die with dignity. No unnecessary hassles, difficulties and other things. Even after death also, the family members should be given some sort of bereavement and grieving process support. This is what in short, and all of us are affected by this, because all of us, we fall sick and sometimes we need to go to hospital, but we do not want to go to hospital. If I ask one question to all of you, of course I should not ask you all these things about death or other things, but if I ask you one question, where do you want to die? Where do you want to die? In the ICU, in hospital, or at home? Think over. And I am certain that most of you will say that yes, we want to die at home. We want to be with our own family members, our children, grandchildren, talking to them, they smiling, we smiling, and this is how we want to die in peace at our own home. So this is what palliative care is, and we are going to talk to you briefly in this particular sessions in basics of palliative care.
And
our second
basics of palliative care will also describe what is the role of community and counseling communication skill, because when you are treating a palliative care patient, you are not treating only physical problem, but you are also addressing the psychosocial, cultural, and spiritual problems. So here the role comes of very good communication skill, counseling skill, and community participation. With the support of community volunteers, NGO, you can help this patient to lead a better life.
Thank you, Dr. Geeta Joshi. I'll add few words more. We say, what is palliative care? It is holistic care. It combines psychological support, social support, spiritual support. All those things come into palliative care, and that is where the community participation is very important to give some sort of peace of mind to the patient and their families. Yes, please.
This is the only speciality where community has very big role to play, because these patients are having a chronic disease which is going on throughout their life. So most of the time they are at home, and surrounding atmosphere plays a very big role in their support and in their treatment. That is why community participation is very, very important in palliative care.
Now you will think that how do we take the support of the community? We generally establish something known as community-based palliative care centers. They are being run in different locations, and Kerala model in our nation, in our country, India, that is the best model of community participation. Community participation takes in the following steps. Firstly, we have lots of volunteers from the same locality. They play an important role. From volunteers, we come over to home care services. Some of the volunteers provide home care services. They establish neighborhood networks. Maybe in 5-6 villages, you have got one clinic of palliative care. In other locality, another clinic, and all these link centers, we may call them, will be generally connected with the main nodal center of palliative care. This is how a network of palliative care centers come up in a particular area. We had gone to Thrissur number of times, and there is an NGO called Alpha Palliative Care. They are doing a wonderful job in couple of districts of Kerala, and particularly in the district of Thrissur. Their headquarters is located at Thrissur, and the director is Dr. Nurdin. Very fine gentleman. Whenever you go over there, please go and approach him and just go around and see all these link centers.
The third lecture is on communication skill. Again, it is divided into part 1 and part 2. In part 1, you will have basic knowledge of the communication skill, and in part 2, you will learn advanced communication skill when you are talking to patient, and advanced communication skill which should be learned by a physician.
Dear friends, communication is very, very important. In fact, most of the times we learn communication when we come to 3rd month of our life. When we come on this planet Earth, we do not know, we do not communicate anything. But when we enter into correction, I'm sorry. In fact, when we enter on this Earth, on this planet, we start communicating immediately. Am I right?
That first cry is the...
First cry. When a child gives out a first cry, that is the communication to everybody, to nurses, to mother and doctors. I am alive, I am kicking, I am fine, don't worry about me. My respiratory system, my vocal system, everything is okay. We call it bacha ro raha hai. No, child is not crying. Child is telling you that I am alive, I have come, and I am thankful to you that I am here. That's the first communication what a child is making. We call it non-verbal communication, because communications are of two types, verbal and non-verbal. And thereafter, when we enter into 3rd month, we start smiling. Everybody, our neighborhood and everybody comes, they just touch our cheeks with the finger and just say, smile, smile. And a child gives a small smile, This is how we continue. And when we are about to complete 1 year, we start saying ba, papa, ma, kaka, all those things, Communication is basic to our existence. We are talking about palliative care. Yes, it is there. Because with the help of palliative care, we come to know what is the condition, how the patient is suffering. Until and unless we know what type of conditions or sufferings the patient is undergoing, we just can't do anything about it. So it is the gentle, polite, loving conversation with the patient that he comes up with all those things. Communication is very, very important part in palliative care. Not in palliative care, it is important in our life also, among our family members, at your work life, everywhere. And in this communication skills part 1, we are going to talk about communications in general, plus we'll be talking about certain special terms: sympathy, empathy, and compassion. And last, hope. We need hope. Hope is alive till eternity. It remains alive. We also say, Asha Amar Hai. When hope dies, everything dies. So we'll try and explain all those things, and particularly we'll lay emphasis on empathy. Our communication should be always empathetic communication, and we should be full of empathy. Thank you.
In part 2, we'll be teaching about the communication skills a doctor should know. Doctor has to communicate with patient in many critical situations, particularly when the diagnosis of a life-limiting illness is made, or when the results of your treatment is not appropriate or not good, outcome it is not good, when the disease is progressing, when the disease is metastasized, or when the terminal stage has started and patient is likely to die. At all this stage, doctor has to convey all this appropriately to the patient, and that is where he has to learn communication. These things are not told bluntly but very soberly in acceptable terms and conditions of the patient and relative. And that is why communication for skills for doctors, paramedics, and the whole multidisciplinary team of palliative care is very important.
Thank you. You said it very rightly. For this type of effective communication in medical field, we have established certain protocols in communication. Protocol means system of rules. And we have got very fine. There are many protocols, but 5 protocols are very, very important in matters of medical communication. First is class protocol. Class is basically the basic dialogue between a patient and a doctor, where a patient conveys what he is going through, what he is suffering through, and on this particular communication, a doctor generally comes and finalize the diagnosis. That is called class. It's an acronym, CLASS. We'll come to know later. Second is nurse. It's a continuous statement. When patient is unable to go forward, he doesn't discuss more, and until and unless patient discusses everything about his case, we can't make out what sort of disease he is suffering through. So we want him to continue. So it's basically for the continuous statement, nurse, NURSC. Then third protocol is respect, RESPECT. Respect is when a patient asks difficult questions and we don't have any answer. We do have answer, but we don't want to tell him at this particular stage. That is where we make use of this respect. Now, after diagnosis, certain lab tests have been carried out, and we just come to know that he's suffering through a very, very dangerous disease, and he has got only few days to live. It's a bad news for him. How do we break the bad news? So we have got a protocol called spikes, SPIKES, breaking bad news. And thereafter, fifth protocol is protocol cons. It is very useful for doctors because doctors are also not perfect people. They are not God. They also might commit certain errors. So how to transmit that a medical error has been committed to the patient and the relatives slowly and gently, that is being taken care of by Cohn's protocol. That is all about the brief in the first week. This is basically what we had covered in the earlier course about foundation course in palliative care. We had just given out a gist. I'll call it, it's a sort of flashback, or in Hindi I can say it is a gagar mein sagar. We included most of the points, huge points are there, but to explain you, we just put them in just one pot, we call it gagar.
And what is the theme of the week 1?
Theme of the week 1, yes, you rightly said.
Yeah.
Everything we collected, we concised, put in one thing, and the theme of number 1 week is knowing the essentials of palliative care.
And
This is
I'm
our thing.
sure you start learning process for this certificate in palliative care course, and you will definitely start enjoying it. All the best. Thank you very much.
Thank you.